everyone, welcome back to my channel. I'm Sonia from Periwinklesoulsdayschool and I'm an educationalist. From the past 8 years I have been teaching toddlers, preschoolers and kindergarten kids. So I worked in Delhi and in Bangalore, and now I'm working in Hyderabad. So today's topic is speech delay and ADHD in kids. So I'm not a doctor, let me tell you first. I'm an educator. I'm not a doctor, but I have done a lot of research by talking to doctors and by taking all their suggestions and by reading a lot of articles. So what all I have researched, I'm going to share it with you. These are all the things what doctors had told me. So let's get started with the video. So in USA there was a kid who was 7 years old and he used to go to school. So at school nobody used to talk to him and he used to not talk to anybody, and he used to not get interacted with anybody properly. So he was a very hyperactive child. So one day his school authorities wrote a letter to his mother, and in that letter it was written that we can't teach your kid anymore, so please don't send him to school from tomorrow because your kid is not normal like other children. So even his mother was the teacher actually. So after reading this letter, his mother started crying, and the boy saw his mother crying and he asked her what happened. Mama, what happened? Why are you crying? And immediately his mother wiped off her tears and she smiled and she said that, my son, from tomorrow there is no need for you to go to school. And the child got restless and worried and asked, why should I not go to school from tomorrow? And she replied, my son, you are very intelligent and the other children are not able to meet up with you. So his mother completely changed the statement, a negative statement, into a positive thing. So from then she started homeschooling that child, and that little boy had ADHD, and because of that he had speech delay problem also. So now can you guess who the boy I'm talking about? Most of you might be knowing that the boy's name was Thomas A. Edison, a great scientist of his age in his days. So parents play a very, very important role in child's life, whether it may be positive or negative also. So parents, be very thoughtful and patient regarding your children. So let's get started. What is ADHD? ADHD is Attention Deficit Hyperactive Disorder. So the name says everything. Attention Deficit Hyperactive Disorder. So before starting about ADHD, let me tell you that there is an important information which I will be sharing at the end of this video. So stay till the end, like the video and subscribe to my channel to support my cause, to support this cause. So in this video I'm going to give you all the information that you don't have to research about this any further. So I'm going to give you every information, the symptoms, the sign, the physiology, the medication and types of ADHD, everything in this video. So diagnosis is mostly, the ADHD diagnosis is mostly done during the age of 3 to 7, between the age of 3 to 7, and we come to know about, parents come to know about this only when mostly when the kids join the play school or the normal school, the nursery. So they start knowing it when the teacher starts complaining to them that the kid is not listening, or he's not following directions and he's distracting the whole class. And so these are all, when it becomes more, then kid is getting hyperactive and he's throwing things around. These are all the complaints that normally the teachers complain it to the parent about their child if the child is having ADHD. So they tell, please take him to a doctor. So that is when parents get to know that my child has some problem. So then they get diagnosed with it. So let me start with types of ADHD. So I've explained you the symptoms of ADHD now, so I'm going to explain you the types of ADHD. So there are 3 types of ADHD. One is inattentiveness. Second is hyperactive and impulsive nature. Third is the combination of both. So first one, let's talk about the first one, inattentiveness. Inattentiveness means he's not able to focus on what you're telling. He doesn't follow directions, and lack of concentration, lack of focus, and we also call them daydreamers. And they're not organized. But one thing, very good thing in these kids are that their IQ level is very good. It's good, or it will be average, or even more than average. But the thing is that they don't know how to utilize it. That is the thing. And the second one is hyperactiveness and impulsiveness. In common language, it is like the energy of one kid in 2 or 3 kids. You can say it as the energy of 2 or 3 kids in one kid is in this ADHD, the hyperactiveness. So they'll always be on a go. They're always constant. They'll always be in constant motion. They cannot sit in one place. They always will be running here and there, and because of this hyperactiveness, running here and there, they get hit. And they get injuries while they're running constantly, and they don't even know that they are injured. So that is it. And impulsiveness means they act without thinking. They act and then they don't think while they're acting. So while they're because of this hyperactive nature, they run here and there, and they get hit, or they hit others by throwing things at them, and later on they realize that they have hit somebody, and the whole day they go on saying sorry to them. But the thing is that they act before thinking. So that is what impulsive means. So, and the third type is combination of both inattentiveness, hyperactiveness and impulsiveness. So these are the types of ADHD, and if it is not treated on time, then it may extend until adolescence and adulthood, or maybe lifelong also. So in primary school it is different, play school is different, in elementary the ADHD symptom, the things will be different, and in higher school it will be different, because in every age the demand will be different actually. So one more thing which I have noticed by reading so much about ADHD, they have difficulty in waiting. So they have difficulty in waiting. It's not written anywhere, but yes, I think that they have difficulty in waiting, and they don't know what is the concept of taking turns, waiting. So they have difficulty in waiting. So let's go to the next concept, that is causes. Why is ADHD caused? What are the causes of ADHD? First is genetic cause. Second is environmental cause. So genetic cause. In the family, if there is if there are somebody who had ADHD in the family, most importantly the paternal side, like father's brothers, father's sisters. So if anybody had ADHD, then they have 50% chance that the child may get ADHD. So that is the genetic cause. So let's go to the environmental cause. Environmental cause is before itself the child has a higher risk of ADHD, and both the parents, mother and father, both are working. So they leave the child with the maid at home, and we can't expect the maid to pay attention on the child's milestones. We just see that the child is getting his basic needs fulfilled or not. That is what we see. So it's a kind of ignorance, we can say, because the parents are busy, so they don't have any other option. So that is one environmental cause. And the second is when you are conceived, when you are pregnant and you take alcohol or tobacco. That is another cause. And one more cause is when you are pregnant, if there is some stress running in the family and you take a lot of stress because of it. So that is another cause, that is third cause. And the fourth cause is when the baby is premature with a very low birth weight. So that is the fourth environmental cause. And these are the few reasons, these are few causes. There are still, research is going on to find out more causes. So now let's go to the treatment. What are the treatments? Let me tell you, whatever problem is there in a child, whether it is autism, or whether it's ADHD, or whether it is behavioral problems or speech delay or anything, if it is mild to moderate, then it can be treated by a therapist or occupational therapist. But if it is from moderate to severe, then definitely the child has to be put on medication. They has to be put on medication to increase the child's behavior, to calm his hyperactive nature, and to convert his inattentiveness into to concentration. And they use stimulants, anti-stimulants, and antidepressant medicines. Actually, the psychiatrist will give more, will explain you well regarding this medication. And one more treatment would be behavior therapy. It works very good with ADHD kids, because the kid of ADHD who has ADHD has behavioral problems. They cannot regulate their behavior. That is what ADHD is. So behavior therapy works very well, very good with ADHD kids. And the third one is reduce the intake of sugar. Because already the kid is very active, then why to boost his energy more? Reduce the intake of sugar. If possible, nullify it. Give no sugar to the kid. It is very good. And the fourth is set up daily routine. Sleeping time, eating time, getting up time, playing time, study time. The kid, unknowingly itself, when you do this routine, unknowingly it comes into the child's mind. Now I just finished writing, so now it is my playtime. So by that the child's mind gets occupied. So that is another treatment. And the fifth one is use Smiley Tokens. Use just small kind of Smiley Tokens, token on which you have smiley on it. You can make it with cardboard, or you can buy Smiley Tokens out in the stationery shop. Whenever the child does something good, you can give him or her that token. So he will want to do more, to get appreciation, and get more and more Smiley Tokens from you. So that is how. And the fifth one is relaxing technique. You have to teach your kid relaxing technique, but for that first you have to be relaxed, you have to stay calm. So and one more thing is keep the authority in your hand, so that the ADHD kid doesn't get physical with you. And the sixth thing is instructions should be given to your kid, and those instructions should be small instructions, like come here, go there, keep this there, keep the plate on the table, drink water. These are the small instructions. If you give to your kid, they will achieve their targets. So when they achieve their targets, it gives them happiness, and when they'll try to achieve more and more targets because they they start craving for that happiness. So that is it. And one more thing is involve the kid who has ADHD in any physical activities like swimming, skating, and cycling, because they actually can be a very good athletes, because their energy gets channelized by these physical activities. So if you follow this, your kid can come out of this problem. And one more thing is, in the medical reports, when you are getting treated, your child is getting treated, on the medical reports it will be written as parents counseling. So it's not just written on the paper, and don't let it be just written there. Parents counseling. If it is written there, you please attend the counseling. They will teach you how to, at which stage, at which behavioral problem with your children, how to react when your kid throws everything at you, how to react when the kid gets restless, and so on. So it's going to help your child to come out of it. So please attend parents counseling. And one more thing is, please avoid preservatives. No preservatives. It increases the hyperactiveness in the kids. So please avoid preservatives. So these are the treatments that I have discussed. Now I'm going to tell you about the physiology of these ADHD kids. So the brain development is different from other kids. As per physiology, the brain development is different from other kids. The frontal region, which is responsible to regulate all the motions to organize, if this frontal region is not transmitting the information correctly to the rest of the brain, that is why the child sometimes have behavioral problems. So that is ADHD. It's not always that it doesn't pass the information correctly. Sometimes the frontal region passes the information correctly to the rest of the brain, and that is when your child behaves properly. Many parents, they go to the doctor and they say, no doctor, sometimes they behave very well. So this is it. This is because of it. Sometimes the information is passed on correctly, and sometimes the information gets cut and it gets passed. So that is the physiology of ADHD kids. One more thing is, don't use physical enforcement on these children. Use positive enforcement. That is how they are going to get treated. And one more thing, and the last thing is, as I already told you in the beginning of the video, that I'm going to give you some important information at the end of this video. So the important information is that give correct information to the doctor. Give correct information to the doctor. Most of my doctor friends told me the same thing, that parents know that it is ADHD, but they don't accept it. Because they don't accept it, they do not give correct information to the doctor that my kid has ADHD. Instead of that, they say that my child has social communication disorder or speech disorder or behavioral problems and so on. So that is why the treatment gets delayed. So please don't do that. Please be fair to your doctor. One more thing is, please be fair to the teacher also. If you are admitting your kid in a play school or a school, please be fair to the teacher. Tell the teacher whatever problem the kid has, so that it will be more helpful in the cure of the child from the teacher's end also. And the third thing is, don't bottle feed ADHD kids who are more than 2.5 years old, because the nipple is made up of silicone and it makes the palate weak, the upper palate weak, and make the kid to have more delay in speech. So please don't bottle feed the kid. Actually 250 ml to 350 ml of milk is more than enough for a kid. And it's not necessary that they get that only through milk. They get it from curd, they get it from paneer, they get it from cheese, they get it from ghee and other dairy products. So it's not necessary that they have to take milk to get that from the milk. So please put this in mind. And one more thing is, don't let your kid to become obese. Don't let the kid, because the treatment will become difficult. The therapy will become difficult. So maintain age appropriate weight for the kid. And this is all about it. And I am not a physiologist, I am not a therapist, but I have gained all this information from different sources, different doctors and different articles. So hope this information is going to help you. And one more thing, this is not a disease. This is not from birth. This has been developed afterwards, and this is a problem and it can be cured. So this is what I wanted to share about you in this video. Few of the parents requested, and I have made it very awaited video this is. So hope you all liked it. If you liked it, please hit that big like button, subscribe to my channel if you are new, and also share it with your friends and family, share it with the parents who are in need, and subscribe to my channel to support the cause that I am doing through. So thank you so much for watching this video, and see you with another video very soon. Bye bye. Take care all of you.